My pleasure to welcome on stage Shraddha Somani, Director Key Account Management, Lead Squared, who will shed light on how healthcare providers can be empowered to deliver efficient patient engagement. Ladies and gentlemen, kindly put your hands together for Shraddha Somani.
Thank you so much, everyone, first of all, for being patient. I know it's a lunch hour, and I promise not to take a lot of time, but would request your attention to something which is very close to us as Lead Squared and could help us all kind of think about how we can empower the patient engagement and also at the same time maybe reduce our cost and earn maximum revenues for the healthcare industry. With this, as I stand here, I think I recall a lot has been talked about technology right now, right? And I recall for a small little treatment of neuro, I was scrolling through a lot of hospitals right now, I think present here, right? Which means as a consumer, I have an access to, sorry, can somebody? As a consumer, I have access to a lot of options right now. The customer journey is not linear anymore, which is where we understand that the healthcare organizations, are not just now catering to the three needs or the three A's, which is access, affordability, and absence, but there is a fourth A, which we have recognized as an organization, which is equally important, and that is accountability. Accountability, one, to the patients for an effective healthcare delivery and management, and two, to the investors for higher returns, more profits, and reduced costs. With an aim to do the same, we at Lead Squared, I will have to fix the slide, just give me 1 second. You'll have to help me. So without actually showcasing the slide, I can talk about it. So I think hospitals historically have been using a lot of systems, as we've talked about, right? HIS, LIS, RIS, billing management systems, etc., right, at the back end, in order to manage a lot of systems, a lot of processes, optimize a lot of productivity issues, or create an experience for the customers at the front end, right? But now the technology advancement has come to a stage where we need to take all our hospital providers at the front end to create an experience for the customer and also to ensure that we are attracting them, we are acquiring them, we are engaging them, retaining them, and then ensuring that our revenues are maximized, right? And Lead Squared as a CRM provider, thank you so much. And Lead Squared as a CRM provider does the same. We are honored to be working with some of the industry leaders in the healthcare segments, including hospitals, health tech, wellness, laboratories, etc., and helping them across these 5 things, right? So, as I said before, attraction of the consumers, acquiring them, engaging them, nurturing them, and measuring the accountability for the investors and the patients. So what is attracting a consumer at today's time? I think in the hyper communication world today, it is super crucial to kind of be wherever the consumers want us to be, right? And a lot of social media engines or WhatsApp or different modes of communication across tier 1, tier 2, tier 3 cities have to be integrated or have to be used in order to send personalized omni-channel marketing out. And which is where Lead Squared is working with a lot of specialist hospitals in order to run campaigns as per the sociological, physiological, behavioral, as well as demographic-based marketing, which helps them to attract the consumer in the right time, bring them to the hospital. Because again, the competition is huge, and to drive a consumer attention will demand a lot of marketing automation. So that's our first suite, which helps you attract the consumer. Again, as I said, tier 1, tier 2, tier 3 cities are the places to kind of gain profits and to reach the Indian economy, but international patients are also leveraging Indian healthcare organizations or Indian healthcare system to kind of, feel better or to get the caregiving. And which is where we at Lead Squared are also helping a lot of leading hospitals in order to onboard their international patients with their histories, with their medical records, etc., and using technologies, embedding technologies like AI, ML in order to kind of do a seamless integration with their patient record history and create an experience from them the moment they enter the hospital. A lot has been also talked about the laboratories, corporate tie-ups, etc., and which is where we're seeing a lot of traction in the B2B space, wherein the hospitals are trying to maximize the revenues from the corporates, as well as the insurance payers are helping the consumers to reduce the cost of bearing the healthcare facilities at a hospital. Our corporate flow tie-up module also helps the hospitals to kind of optimize these processes better. The second part is acquire. As I've talked about some of the marketing schemes which kind of, get your attention for the consumers. In terms of attraction, in terms of acquisition, I think we need to take a step further. Be it us calling them through our call center agents or our field sales agents, on the fields to track the doctors, to track the patients, or to track the pharmacies who actually create a referral business for all of you guys as hospitals, right? And which is where our field sales agent modules or our doctor onboarding platform kind of seamlessly brings an ecosystem together in order to run the process ahead. Appointment booking and contact management system, which kind of generates auto prescriptions for the consumers using the AI ML mechanism. Now, do you only stop at really giving the medical treatment in today's time? I think it is a lot about opportunity versus a lead, right? You're not just catering to a patient, you're catering to their entire family, you're catering to their entire friend circle. Word of mouth is the biggest source of lead generation for hospitals in today's time, right? And which is where, when we talk about increasing or enhancing the patient engagement, we want to build right set of feedback modules or right set of surveys in order to see where do we stand in terms of our NPS, how are we delivering against the experiences that the patients are asking for. Nurturing them, again, as I said, not just the patient feedback, but not just the resource management. I think the talent management also lies as the biggest challenge that we have observed with a lot of our customer base. By talent management, I mean the right doctors placed as the right caregivers for the right patient at the right time in the right place, right? And which is where the doctor satisfaction surveys are as crucial as a patient survey module at this time. Now, while we're talking about attracting and acquiring consumers, I think cost of acquisition remains a pertinent topic for hospitals to, give answers to the investors, right? And which is where, and there are a lot of costs any which ways, medical equipments, the supply, and the new technologies coming all the time. We've just spoken about AI being so expensive, right? So how do we bring down our cost of acquisition, right? Small little steps. For example, when we're talking about getting attention from the consumers through marketing campaigns, etc., right? We can reduce our response time to attending those queries in order to ensure that the sales productivity is optimized in the best manner. For the sales agents who are on the field, we can use the geotagging, features like geotagging or geomapping in order to ensure they are mapping the doctors in a maximum way in a certain region, right? Which helps you, again, increase the productivity of your sales people. Talking about appointment to visit ratios, I think it's a very, very common challenge that is faced by every hospital. You fix 100 appointments and then the consumer will do a Google search again and maybe land into some other hospital, right? How do you ensure that this patient is being attended by your hospital in the right time? It is through the right marketing campaigns, driven in the right channel, driven in the right language and in a personalized manner, again by embedding the AI ML algorithms to see what laboratory test has been created for that patient earlier, what pharmacies is he currently going to or taking a supply of medicines from, and then creating auto campaigns for them to attend to certain queries like these. Tracking everything that your agents do. This is a sales module which is being leveraged by leading hospitals right now, leading laboratories that we are working with today, in order to double their or triple their sales productivity of the agents on field. The last part is measurement, right? When I talk about accountability, I think, in order to measure a smallest investment, which is going into a drip campaign, to really figuring out what equipment do you have to purchase, how many bed capacity do you have to create in the hospital, going to the last extent of the billing operations for any patient, has to be measured in the right manner. And CRM technology or a product like Lead Squared does not just help you manage your leads or marketing, but takes it a step forward to actually measure the outcomes or the ROI of all your investments in order to ensure that patient's effectiveness, patient management is effective, and again, your ROI is maximized. I'll take a pause here. We have a small booth there as well, and I'll open this for any sort of questions for me right now, or else we all can meet outside for the lunch and maybe chit-chat more about this. Thank you.